some contracts prior to the new contract. So in 2006, this contract came along which said you're going to have this guaranteed amount of income. Prior to that, the difference was that it's sort of fee per item. So whatever treatment you do is what you get paid for. So there's sort of pros and cons. So if you speak to some of the dentists, they will say, actually, it's nice to have a guaranteed income and know every month I'm going to get X amount of money in comparison to if I treat, I'll get paid. If I don't, if I take a week off, I'm not going to have anything coming through. So there was quite a variance. But in regards to the practices that did stop, two of them did come back and they actually only had child-only contracts, which meant that they were actually being paid for seeing children under the NHS only. And other than that, the adults were seen privately. So those two, when they were going to pull away, we did feel a little bit like actually there might be a bit of a misconception anyway for the parents. And how do you monitor that to an extreme as well? Because there is something about patients ringing up and saying, actually, I thought I'm going to be seen under the NHS and I wasn't. So the four that have gone from North West London, I couldn't tell you about all of London because that was 2006. And as you can imagine, jobs and roles have changed. Even though I've been in dentistry commissioning, I was North West London and now moved to the region over sort of 4 years ago. But all of this happened to prior for me running all of London. So I wouldn't be able to tell you the exact figures, but some practices did pull out from the NHS contracts. But in London, we didn't have a massive amount. We didn't have a problem as such where we thought, right, we're going to struggle with the amount of patients. And as you can see right now, as we're talking about millions of pounds coming back, it's showing us that we have the funds available and the dentists, we have enough capacity. We just don't have the patients going in.
I couldn't give you figures of how many practices have gone private, but there's a lot of practices that are doing less and less NHS, which may also account for the clawback. And I can tell you the reason why is because NHS has been underfunded for many years. There's been very little increase in the NHS to dentistry, the NHS dental budget. And as a practice owner, I've seen my costs over the last 4 or 5 years go up about 30 to 40%. Costs for salary, costs for materials, costs for laboratory work. Most of our materials come from Europe. In the last 4 or 5 years, last couple of years, it's increased by 15-20% in terms of costs. So our costs have gone up dramatically. The NHS income has flatlined over the last 10, 12 years. We've got very little income. So it's hardly surprising that those practices aren't being able to cope. So there's a huge problem about the reason why practices are doing more private work is actually to keep their head above water. It's an independent business. It's a practice they run to provide healthcare, but they still have to run a business, have overheads, look after their staff, pension contributions. All of it contributes to it. So the NHS is not. It's kind of this sort of general indifference by successive governments, in kind of for too long. Oral health has just been sort of treated as kind of an optional extra as far as successive governments are concerned. So that's the problem. You know, I can give you the figures, but we can easily find figures on how many people have gone private.
Can I just come in, right? Because I just want to. I find this very inconsistent, right? Okay. Here you're saying that children's dental health is suffering in London. You're saying that £80 million are coming back to you as a reclaw. We have a dental problem here, okay? So there is a question about capacity, right? Because dentists don't feel they want to be treating this patient at this prices, okay? And yet we spend £9 million every year on dental extractions, right? There's a problem here. You can't simply say that we have no capacity problem, we have no funding problems. There's a problem here, and I want to know what you do about it.
Well, could I maybe come into this, because I think the issue of dental services and the clawback and fees is a very important one, but it's only part of the issue, because I think, you know, hopefully when we continue the discussion, if we look at to address this problem of dental disease in children, the solutions lie in dentistry for sure, but they also lie beyond dentistry. And one of the biggest challenges we've got is that the funding in local authorities for a lot of the community-based intervention. So what we'll hear soon is about fluoride varnish, so applying fluoride to children's teeth, action to reduce sugars. A lot of those initiatives, the funding was reduced considerably over the last few years because of local authority budgets being stretched considerably. So the public health funds in local authorities is diminished greatly. And as Len says, you know, there are other public health priorities that local authorities have to address. So I think in some ways, focusing only on dentistry is not really the complete picture. It's an important part of the picture. We need the dentist to be happy in the system. We need access to be improved. But just getting people to a dentist isn't going to solve this problem. We know that. There's other issues as well. So I suppose just to say Kelly is doing, it'd be interesting to hear what you've got to say, but that's not going to solve the problem of these children aged 2, 3 having general anaesthetics when the disease is preventable, and that can be avoided. So it's sort of, in some ways, not Kelly's fault, in inverted commas. There's other issues that have to be considered.
Can I ask Claire, the NHS has just published its long-term plan. In that, is there any measures to reduce inequality in dental health?
Not specifically, but actually around the sugar reduction and also involving the wider workforce. We need to make sure that oral health is part of everybody's business, that it's on everybody's agenda, and making every contact count of our frontline staff, the health visitors, so that not only are they talking about sugar and weaning and reducing the impact of sugar, but also increasing awareness around toothbrushing on a daily basis, particularly last thing at night, but also signposting families early for prevention in dental practice. So we need a whole systems approach.
But there's no specific
if you search for dentistry and oral health, you won't find it very often. You get a PDF and look for it. In 5-year plans, 10-year plans, you won't find it. That's the problem.
Maybe I could say that the previous 5-year plan had not one mention of oral health. This one has got a few more mentions, but Len is correct yet again that oral health is not a big priority. But the Chief Dental Officer in Whitehall, she is trying to make these links across different areas. So there are things, for example, around obesity prevention, and the links between obesity and dental decay in terms of the causes are very similar. So there are some actions happening to address these inequalities. But in your Mayor's Health Inequalities Action Plan, there's actually lots of things happening in terms of early years that directly impact upon oral health.
It's just that seems to me is that you're trying to make up for the failure of any direct targets in the NHS plan. You're trying to get around it another way, which may be a very sensible thing to do. But if you had direct targets and mentions, it would make your job a lot easier.
You would, you're right.
And it's a credit to the Mayor and London Assembly to do that because it's kind of ignored on a national basis. So having innovative ways of doing it, we are absolutely supportive, the media is absolutely supportive of the Mayor doing those sort of things and having those initiatives because clearly Westminster's abrogated the responsibility as far as that's concerned.
Okay. I can move on then. We know from the surveys you've done that most of your dentists actually do preventative work outside their practice. But do you know how much of that work is specifically about trying to address dental health inequalities?
Just to clarify, what do you mean outside of their work?
I think we have here that 70% of BDA dentists say they're involved in some kind of unfunded oral health promotion. Okay, so I'm just wondering where they are directing that. Is that to the children that really need it?
They can be. So lots of practices, our practice included, will send dentists, young foundation dentists, and our oral health educator out to schools, out to nurseries to try and do that. But again, we're taking staff out of our practice. It's unfunded. We're doing it because we feel we're part of the community and we want to do it. But there's no sort of mechanism to do that in that way.
Well, I mean, there are initiatives across London which Kelly hasn't had a chance yet to talk about. But so the independent practitioners have work that they're doing that's not part of their NHS contract because they're engaged with their local community. Local dental committees have now beginning to get together to run some community-based projects across a wide range of topics, including children's oral health, and so that members of those committees are banding together to get some work, particularly in their own local areas. Health Education England runs programmes as well for the foundation dentists that Len was talking about. So there are a lot of initiatives, but for when the BDA would survey a dentist, it may not come forward as a sort of a collective group doing projects A, B or C, because it's the individual practitioner answering a survey on their behalf. So it's very dependent on the person that answers that survey. And of course the information is really very helpful, and it does help us plan on what we can do better when we have that statistics. But then they're answering from an individual person's perspective rather than what's actually being organised across their area. And in London we have a pan-London approach in terms of all of these initiatives that Kelly has begun to deliver over the last couple of years with help from Claire and others, and with everybody's help.
Just to follow up on that point, I think it is important to consider that the dentist link to the community is a really important issue about being able to be better connected to other health services, health visiting GPs, and there have been some various initiatives about joining things up in a much more coordinated fashion, because a lot of high street dentists have tended to be a bit isolated and not really linked in to their community. So that, I think, is a very important issue. But the other point just to consider is when dentists go into schools, etc., we do need to make sure they're following evidence-based guidelines in terms of what works. And there's a whole scientific literature about interventions, and just someone pitching up for one appointment, that's not going to change things. So it's we need to encourage those links with communities, but it needs to be also following evidence in terms of what we know, what works and what doesn't work. And then the last point to mention is that in terms of prevention, in this country, Public Health England have got an evidence-based toolkit. So this is called Delivering Better Oral Health. Now this is one, across the world, it's a real example of excellent evidence-based clinical prevention. And one of the real sort of challenges is to integrate that more across NHS dentistry, because we've got the evidence, we know what does work, but the levels of adoption of that document are still quite patchy across different practices.
Thank you. I'm going to come to Kelly now, really, to let you tell us what the NHS is doing to raise awareness, particularly around the fact that children are entitled to free services.
Sure. Okay, so there's three parts to this. So I'm going to talk as quickly as I can about each part and summarise it as best I can. So Starting Well 13, which I talked about first, was an initiative for the whole country, and Ealing is the borough that we were asked as one of the most deprived and obviously highest decay rates, etc. And therefore Ealing was the borough that we were working on for Starting Well 13. This meant an advance contract for a number of practices. So we invited all our practices in Ealing to come on board. We had 12 practices that went ahead after expressions of interest. So they get additional funding, and this is for seeing children from 0 to 5. And they have to take part in 3 open days in their practice. And that open day can be either outside of their practice, or it could be them going to a school or a local community event, etc. And getting those children to come in, educating parents, educating everybody who walks through the door. So basically right from the reception, when somebody comes in with a newborn baby or a pregnant mother, to say, actually, we're part of a Starting Well, which is a piece of work, a project. They've even got a certificate in their waiting area. They've actually, if you look at how to find an NHS dentist in Ealing, they've actually got the logo, which is this NHS toothpaste logo saying they specialise in seeing children 0 to 5. So those children, what we're trying to do is get those children to go in to see a dentist as early as possible. And when they do that, we're going back to the point that we kept making, which is trying to get these children to come in early, trying to get them to make sure they're not having the sugary snacks, brushing twice a day, etc., etc. So all of that educational work has been taking place. The practices that have been working in Ealing, they have a champion in their practice. So one person who's in charge of feeding back to us with regards to audits, how many children each dentist is seeing. So they have a clinician within their practice that's actually leading on this. They have monthly meetings about children. So that work has been carrying on for 1 year now, well, over a year. We've had feedback with regards to, we meet with those practices in Ealing once a month. And when we've got a network for them, so we've had feedback on how they're getting on. Support-wise, we've actually provided them with resources. So obviously the sugar smart things that you may have seen, about how much sugar is contained in soft drinks, etc. But over and above that, we've done healthy eating leaflets, how to find an NHS dentist leaflets, toothbrushing charts for children, etc. So lots of work that we've supported these practices with. With the open days, as an example, one of them that we used was as a parade that takes place in Southall and usually has around 40 to 60,000 people attending. It's a Sikh festival of harvest which goes through sort of the whole of Southall, and that was one that we thought would be a really good one to target, because you'll get a massive community. You won't just get patients from Ealing, because to be honest, that event is a religious event where people actually come from outside of just Ealing, so neighbouring boroughs as well. And actually, I got Pepe and Claire to attend as well. It was a very rainy day last year, unfortunately, when it happened. But there's lots of food that's available for everybody. And we actually had all of us going out to patients. So while they were actually walking this parade, we walked along with them. And the good thing was they actually passed 10 of the 12 practices, which was really helpful. So as you can imagine, rather than having an open day, they actually all took part. So there's a whole group of us that were actually walking along with the parade. And as a result of that, we got just under 500 new children coming in to see a dentist, and it was awareness. We talked to a lot more than 500 people, because there's probably about 50 of us with the NHS T-shirt logo and going out giving leaflets, etc., and giving toothbrushes. But as you can imagine, the amount of people we talked to was probably in the thousands. Again, language, so where they weren't speaking the language of some of us who can speak the language, we spoke to those patients, spoke to those people, the public, and we did see that actually worked really, really well. So what we're looking at is doing more of those. So open day is one thing, because you tend to say, as you can imagine, if you say your dentist has an open day and a banner outside.
Can I ask, are you going to measure whether those children return in a year's time?
Those are registered, those are recorded regardless. So we're recording absolutely everything we're getting on these. There's a full audit on this. Because it's a scheme that's auditable, it gives us every single child that's actually coming on this scheme. So yeah, we're able to pick.
You can see whether they're having their full appointments.
Yeah, because that contract's only, so the thing I should have said is this is a pilot pretty much. So the starting well 13 that we're doing in Ealing is a 2-year pilot. So we will need to sort of look at year 1 and year 2 and actually do we continue, are we able to continue funding wise, etc. So that's part 1. Now you may be listening to that thinking that's absolutely great, but that's just Ealing, and that was what our view was as well. But we don't have unlimited funds to be able to do this because it was Hansard. We had to do it. So I could quite easily go to my director and say I have to do this because the funding needs to go in here. It's really important. It's come right from the top. When that doesn't happen, we're in a more difficult position. So I can't really argue of, I know that things can work because Richard just mentioned delivering better oral health. I mean, I was part of that for the fluoride varnish 10 years ago with Barry Cockcroft, who was a then Chief Dental Officer. And we know that worked really, really well, again, for one borough in Hounslow, but we weren't able to expand that out to the whole country. It's in the delivering better oral health as part of the toolkit, but it's not something we can expand because all areas don't have the funding. Yeah, you don't automatically get the money for these things. The thing I am pleased to say, though, is we have something called Starting Will 13 Plus, which is something we've called it ourselves. So this is the Ealing equivalent, but we're trying to expand it out to all of London. And what we're trying to do is get a minimum of 2 or 3 dental practices in each of the boroughs to do exactly the same. So they'd work on the same scheme as the Ealing project. The cost for that is around £1.6 million. But then we've talked about the underperformance and we've talked about the commitment of NHS funds. So I have managed to take that to our board and get some agreement with regards to being able to expand this outside of Ealing, so that those are the boroughs we've talked about where we need people to specialise and actually highlight more awareness. We're actually going to be expanding Starting Well 13. So Starting Well 13 is Ealing. Starting Well 13 Plus is going to be the whole of London. We are in the process at the moment of completing a form for criteria, etc., for practices. And the other thing to say is if a practice is meeting target, we are going to be looking at those practices to be one of those. But if a practice is underperforming, we could actually look at some of those to continue doing the same. So they could be on that project and it's not going to cost us anything because it's going to be cost neutral. So as much as funding is concerned, we're going to try and do this in the best way we can and hope that we're going to make a real difference, because we know in Ealing we have made a difference by doing this, and it's making sure that we're able to do that outside of there. We expanded it at the moment to Hillingdon because we've had a new practice that's opened in Hillingdon. And again, that practice in Hillingdon has done some amazing work with children. So again, we're seeing and working with the community dental services. So it's been a joint venture. And actually, when you've done that, working with the local authority, working with other stakeholders, being the local dental committee, the community dental services, and the local authority, who are absolutely key in all of this, we've actually managed to pick one area, do something different, and we can actually see a difference. So we plan to expand that out, and it will be out and expanded, hopefully, by the time we get to this summer. And it will be a pilot. We're hoping to try and do this pilot for 2 years, but as you can see, if we're doing it in Ealing, we do think that's going to have an impact.
That might be something we want to push, because it seems that you've developed best practice before, but that not have the funding to roll anything.
Exactly.
Out.
Exactly.
And as Kelly says, I think it's really important that everybody across the sector knows who's doing it and support them, because the CDS, as Richard has said earlier, are well placed to do the training to help dentists who may not be familiar in treating very tiny children, to give them the confidence to do that. So whilst the funding will go into the practices, I think it's really important that other sectors across the dental services in London help support them, because the hospital dentists who are unfortunately receiving these children who have a high need, because they've been identified, an extra 500 children going into Ealing practices as a result of the initiative, then many of those may have high needs, and so they need to be picked up by, unfortunately, if they do require a lot of dental treatment, you can't deliver that to a 5-year-old because they just won't sit still long enough. So it's coordinating their care to get them dentally fit, possibly over one general anaesthetic, and then be able to, as you say, go back for further prevention, so that you don't meet that child or their sibling again in hospital to take out multiple teeth.
Can I ask, do you do work with children's centres?
I was just going to say that actually it requires working in tandem with the children's centres, because the dental practices from Starting Well are reaching out to the children's centres, but also the children's centres are reaching into the local dental practices. So it's working both ways, and actually it's paying dividends, because we are seeing the increase in numbers of children under 5 going into those practices.
But we know children's centres are under enormous pressure in terms of their funding, and the constriction of children's services, early year services, has been dramatic across London. And I suppose I thought your question was going to partly be about also sustainability, because around this table, a lot of us have been here for a long time, and these projects, pilot projects, money's put in, but it's always short term. So the longer term, sustainability is the key challenge, coupled with the inequalities agenda, because these pilots often can start, but do they make a meaningful difference with the communities where the disease levels are the highest? And often the evaluations we have don't show that. So that is the major challenge that remains, I'm afraid.
So can I just, sorry, I was just going to say, just I can finish on the projects. I haven't finished yet. So that's the second project, which is Starting Well Plus for all of London. The third one is Starting Well Core Contract. Now, this is the one that the Chief Dental Officer talked about, and it's in the long-term plan, and it's mentioned in sort of half a line, but it's there, so we're pleased to see it's there at all. And this is actually seeing children from 0 to 2, so before their second birthday, getting children to go in to see an NHS dentist. As part of this, a lot of the areas around the country actually said, this is going to cost us a lot of money, and therefore we're only going to look at specific areas of deprivation. But in London...
Health visitors, though, isn't it? You could have conjoined with health visitors.
Absolutely, yeah. But so for London, what we've managed to get agreement is to actually go for all of London. So we've asked all our dental practices to go ahead and work on the core contract, and we would fund all practices. So basically this is, for them, if they've hit their target, they'd get an additional 2% to see these children that are 0 to 2. And we did have 3 massive events last year to publicise this with all our dentists. We invited all our dentists to 3 big events, and we did actually I talked quite a lot about Starting Well Core Contract, and we had feedback after the event, which obviously they fill in a form and say whatever they need to, and 95% of our dentists have actually said, we didn't realise there was a problem with children's health. We didn't realise we should probably be seeing more children, and actually we will be making sure this does happen. So it was really nice to actually see that kind of commitment from them as part of Core Contract. So also as part of Core Contract, it's really important to just highlight to you, one of the things that I shared with everybody at these events was these documents, which we'll share with you, but I just think they're really important. They give you each of the boroughs, and they actually tell you how many children under 2 are residing in the area and how many are actually with an NHS dentist. So as an example, if I just take from North West London, if I take Hounslow as an example, there's 8,500 children that are residing in the borough of Hounslow from 0 to 2, and only 700 are with an NHS dentist. If I did the same in South London and took Greenwich, 9,000, actually I'll take Croydon, 11,700 children residing, and only 700 are with a dentist. So as you can see, our gap of awareness is so big, and this Core Contract, and actually everything we're going to do is going to make a huge difference, because it's us trying to get these 11,000 children that have never been to a dentist. So a massive gap, and one that we could really target. And again, East London, if I just take Barnet, 10,500 children registered, 742 with an NHS dentist. So we're working on these, and we've actually got top 6 areas. We're looking at doing stands in all public places. So we've talked about children's centres, we've talked about working with the schools. This is also going to be in shopping centres, so all shopping centres as much as we can. Hospitals, so when parents are going for a hospital appointment or grandparents are going for hospital appointments. And also in religious places, so be it in temples, etc. We just think it really does help. And getting people within the team that can speak those languages and are able to work with those people and speak to people to inform them of these things. Because we know in the past, if we think about things like smoking cessation, etc., when they've been done in the right places and you've talked to the right people, you do get an outcome, and you do actually target the right people. So it's from our perspective, it's about diversity. It's really important, I think, as far as diversity is concerned, because some of these boroughs, if you actually look at, when you go into those boroughs and you have a stand in there, you actually have very few people who can even speak the language, and that's where we've actually said we really need to make sure we're taking all of that into consideration, because we're not going to make a difference to figures until we target absolutely everybody we can. We are working with the local authority, and it's really important, I think, to mention that oral health promotion is not actually the remit of NHS England commissioning team. We commission dental services, but the local authority are responsible for oral health promotion. So going back to what Richard had said, I think it's really key. I can sit in front of a lot of the local authority, and I have, and said, we've got some great work we can do, we can really make a difference. And they've said, well, actually, unfortunately, we don't have any money to give you. And where we can, NHS England has actually turned around and found money to do some of these things. So some of these initiatives that we're talking about, actually, all of these initiatives we're just talking about, NHS England is actually funding. So we have actually tried to really put our finger in our pocket as much as we can and get as much as we can funding-wise to do all of these initiatives to make a difference. And I know Claire could talk about toothbrushing in schools as well, which is something we're trying to link. So it's all about collaborative working. And I know when this meeting was being put together, there was something about collaborative working. The local authority, NHS England, the dental practice, community dental services, public health, are we working together? And the answer to that is absolutely. But this is probably the first time we're doing it to this scale, where we've actually got the funding approved, what we're able to do. But like we said, this is short term. It is going to be for 2 years. Yes, we might have a great impact, but actually at the end of the 2 years, we're going to be sitting back here having the same conversations unless we actually make sure we can put some funding into this more long term.
And I think from our perspective, from the BDA's perspective, we're very supportive of any initiative that's going to improve oral health in London. The difficulty with the Starting Well scheme, fantastic. It was new money. It was extra funding up front for young children. It had oral health champions, just as Kelly suggested. I think the problem with Starting Well Core actually relies on practices hitting their targets. I've just told you that most practices don't hit their targets. Only a third of dental practices are managing to achieve their 100% targets. So they're not even so what we're doing is recycling money again and again. So they don't hit their targets, money gets taken off them, and it goes to the Starting Well Core process. So this is so the reason why it's not going to be sustainable is because it's prefaced on the basis that we have recycled money. Money gets clawed back of dentists, it doesn't go back, and it goes back in the system by innovative ways that conventions are trying to do with the money, and it doesn't last a long period of time. So our concern is if you don't hit the targets in the first place, you're not eligible to do it, and only a third of those practices actually hit those targets. So that's our concern. Totally supportive of anything that commissions can do, anything we can do to help oral health. It's the mechanism that's not sustainable in our view.
Okay. Earlier this week, I went to a nursery in Havering, which is part of the Healthy Early Years, where their focus on achieving the award was dental health. And so I saw children brushing teeth regularly throughout the day, and having a lot of talks and playful ways of learning about sugar, what they should be eating. And certainly what came across for me, that was all wonderful stuff, but actually the impact it had on the parents, with the children actually putting pressure back on their parents to want to go to see the dentist, because all the staff took photos when they went to the dentist and they were on the notice boards. They were telling their parents what they should or shouldn't be eating. And that seemed a very good way of that nudging parents, if you can get into schools and into nurseries and doing that. So what are you doing? And you've talked a little bit about what you're doing about sugar, but what are you trying to do about nudging those factors that lead to decay.
Well, I could just sort of reinforce that point because I personally, well, I live in Islington, but I've worked in Islington for a long time, linked to the Public Health Department, and many years ago, Islington Children's Centres, they all developed healthy eating policies, and what we did was ensure that oral health was very much integrated into that. So many of us have said the need to integrate oral health into these other initiatives. So in Islington, we had very good written policies on healthy eating, which included sugar reduction, also included about toothbrushing, etc. And that really moved forward in a big way. But as you know, those services things have changed dramatically in the last few years. So another initiative I think that is important, which again in Camden and Islington again there's a lot of emphasis, is even going earlier than children's centres, looking at breastfeeding initiatives, promoting breastfeeding, because we know one of the risks for early childhood caries is children being introduced to bottles with sugars in them, and bottle feeding is a major risk factor. So linking breastfeeding initiatives, baby-friendly hospital initiatives, there's an awful lot of work to do around that is core public health, that is core child development, and also would have a positive impact on oral health. So I think those initiatives I know are happening, but the resources to support them are pretty stretched, to say the least. And so those early years initiatives and starting well is the core element that I think we can look at beyond the clinical dental service remit. And I suppose one other important element is about fluoride toothpaste. So one issue that we have made progress on, but we still need to make more progress. Scientifically, the effect of fluoride as a prevention for dental caries depends on how much fluoride there is in toothpaste. So children's toothpaste in this country used to have quite low levels of fluoride. Now most of them, almost all brands now have the 1,000 parts per million or above. Now that's an initiative, but we need to keep helping families to ensure they have access to fluoride toothpaste and toothbrushes. And children's centres, again, have got a role there, but so do health visitors and other professional groups, because the costs of these things can be considerable for families on low income. That can be a real barrier, and there have been various ways of trying to help people access such things as fluoride toothpaste and toothbrushes at either cost price or at reduced price.
Okay,
and following on from that, we do have across northeast, north central and northwest London supervised toothbrushing programs going on. Certainly there are over 10,000 children in northwest London who are undertaking on a daily basis supervised toothbrushing, but we need to do more. We need to industrialise that across London, and as you were saying, it really does have an effect of pester power on parents, because once they get into the habits and establish those habits, then they take it home and they say to mum, dad, or other members of the family, look, we need to brush our teeth. And that starts off those habits that take them through to the rest of their life. So supervised toothbrushing programs do work, and we've got evidence from Scotland and Wales, and we need to be learning from our partners that these programs do work in the community.
And that supervised toothbrushing is actually being done by the Mayor of Manchester, doing exactly that, and it's working very effectively. So there's no reason why we can't do it in London. The point, and I'm very supportive of the commissioners doing what they're doing, but we've also got to realise it is just a drop in the ocean. We're talking about a very small number of practices, talking about 12 practices starting well out of 1,500 practices in London. So it's a start, but it's a drop in the ocean in comparison to what Professor Richard wants to do in terms of changing the oral health of London. If Mayor Khan wants London to be the healthiest city in the world, it ain't going to happen unless we have joined up thinking.
I think just to add to that, so 12 practices for Ealing, but I've talked about Starting Well Plus, which is exactly the same contract, but we're going to be expanding it to all of London, and we're going to have a minimum of 2 practices per borough, so we won't just have 2. We will have a minimum of probably 4, because you have underperforming practices as well, so it will be expanded out, which is why we want to do that. So I absolutely take that on board, because as you've said, Len, the Starting Well call is only for those that hit their target. If you don't hit your target, then the Starting Well call, you won't be getting anything additional. However, if you are an underperforming practice and you are one of the practices go for Starting Well Plus, you will get funded for doing that as well. So you've actually you do have sort of something to fall back on as another contract that we are putting out. So Starting Well will be expanded out to all of London. That's what I was saying at the start, that we are going to be, what we're doing at the moment is just putting together what that looks like, but by summer we hope to have the whole of London under.
And for that programme, how many years funding have you got?
2 years it would be.
2 years?
Yeah, yeah.
Okay, thank you.
It's the same as a Starting Well call with outreach support. So
Absolutely,
okay.
absolutely. And the only thing that we wouldn't probably put in there is that we find that the audit can be quite difficult for practices and a lot of time consuming. So if anything, we're going to try and simplify it for practices outside of Ealing.
Well, Kelly, thank you very much for describing all the good work in my constituency, which is Ealing and Hillingdon.
Which much is funded though.
And also, of
future
course,
years.
talking about that event, right, which is the Nagar Kirtan ride, which will be on the 7th of April this year,
Yes.
with even bigger attendance,
Yeah.
because this year they're celebrating the 550th birthday of the founder of the Sikh religion, right, Guru Nanak. So the audience will be even bigger on this time.
Absolutely.
Hopefully you come along and welcome to whoever's listening else.
I think it is important to realise that improving oral health is not just about the dental services and what we can provide from NHS England and practices can provide from beyond their contract that they wish to. But it is a combination, joined up working between the local authorities and those the agencies that are providing the oral health improvement that they've commissioned. So that often through the community dental services. So it has to be a joined up approach, as others have said.
Before I get Assembly Member Arbery into the conversation, there's a recent study which shows there's a connection between toxic air and mouth cancer.
Would you like me to speak about that?
Yeah.
Well, with my other hat on as an oral medicine practitioner who sees lots of patients who have precancerous conditions and oral cancer, that the overwhelming evidence is tobacco and alcohol for oral cancer, and then for oropharyngeal cancer, the evidence is around HPV. So whilst I'm not particularly up to date with the toxic air, I'm very well aware of the impact for children and asthma and their general health, but oral cancer per se is tobacco and alcohol, and oropharyngeal cancer, it's mainly HPV. So it will have an impact, but quite a small one. But I would defer to Richard and his public health knowledge that may have different evidence.
I completely concur that for oral cancer, the absolute identified risks are alcohol and tobacco use. And in some communities, of course, chewing tobacco is an issue in parts of West London and other communities. So tobacco chewing or betel chewing is again another risk for oral cancer. But I think the toxicity here, I think that's probably one of these spurious findings of research when they probably haven't controlled for other factors and something's emerged. But in terms of the scientific evidence, exactly what we've heard, the alcohol, tobacco.
I'm grateful for that. I really wanted to get this on the record because our briefing was there was a link between toxic air, right, and mouth cancer. I just wanted to make that.
I think, just following on from Richard's point, and I think that the big point is to make in terms of the specific oral health messages, palm chewing is a real issue, which is basically areca nut and tobacco, sort of South Asian population, particularly in Tower Hamlets. I worked and trained in Tower Hamlets. It's a huge amount, but there's a high usage of PAN in 12 to 18-year-olds. Yes. And as Pepe will know, there's a risks of oral cancer, submucosal fibrosis, a lot of other things related to that. And again, it's education, it's cultural issues about recognising what is a cultural thing to do, what the effects it has in oral health, and Pepe will know sort of the consequences of that when they turn up at a clinic.
It's tobacco in all its forms, so shisha, pan chewing, and with pan it's not just tobacco, it's areca nut as well. So and there are genetic elements. So there's a group in northwest London as well who have a genetic preponderance to have mouth cancer because of their cultural habit as well as their genetics. But I would like to see that the work that's supported in terms of health promotion, it's all forms of tobacco, not just cigarettes, and not to get skewed on the debate about, whilst they're safer, e-cigarettes, there is still a risk.
Okay, thank you. Tony?
Well, I was scheduled to ask you about diversity, Kelly, but you seem to have covered it. But the only thing that I would raise with you about your sort of very successful campaigns that you've had in Ealing and Hounslow when I compare the list of boroughs which have the most successful attendances at dental surgeries, I see that Hounslow is the third most successful and Ealing is the fifth most successful of the 32 boroughs. Aren't you going for the low-hanging fruit in having your campaigns in those two boroughs?
The issue that we had with regards to Ealing and Hounslow was actually decay rates in children. And so it's actually not just generally children accessing services, but it's the gap between the amount of children and the drop that we've had since the new contract. So those were two of the boroughs, but actually we've got Tower Hamlets as one of the other top five. We've got Southwark, Croydon, Newham, Hillingdon, Greenwich and Barnet, which are others. I mean, we have the figures of what the increases look like in regards to the figures and what the children's look like. But the Starting Well 13 in Ealing was something that was presented to us by, was it 2016 by? Yeah. Alistair, yeah. So it was 2016. It was actually raised. So that was that was one that we were given to do, Ealing, rather than one we actually picked. If that makes sense. Simply because of the amount of, and it came through a BDA event.
You understand that people like us are sceptics, and you come to us, and obviously you present the best case, and we look at it and say, well, do you know, that's truly wonderful, which is what I was thinking, because Hounslow's mine, just as Ealing is his. Okay. and then I probed the figures. The only outstanding thing that I want to ask you about, you told us, Professor, I think it was you, about not sufficient fluoridation in toothpaste. I note, I'm not an assiduous watcher of advertisements, but it does seem to me that the commercial advertisements that one sees on terrestrial television at any event don't seem to mention fluoridation at all. Indeed, I cannot remember fluoridation being mentioned at all, probably in the past decade. Is there any reason for that?
Well, maybe just to clarify, there's two separate issues there. So the fluoride content in toothpaste, and you're right, the adverts for toothpaste, mostly they sell their products about freshness and appeal and appearance, etc. But if you look carefully at the labelling, the vast majority of mainstream toothpastes have fluoride in them, because we know that's the most important ingredient in terms of caries prevention. Now, there is a bit of a concern that some of the new brands that are looking to appeal to particularly young people and people who are concerned by different chemicals, etc. Some of those trendy new brands do not have fluoride in them, and that is a concern, but they are by market share a relatively small proportion of the market. But the second issue that you raise, the word of fluoridation, we use that term more for the addition of fluoride to public water supplies. Right. Now, in London, we do not have water fluoridation. So in this country, Birmingham and Newcastle are the main cities, urban areas, with the addition of fluoride in their water supplies. And again, the evidence on that is that it does have a beneficial effect on reducing children's dental decay and indeed adults. The complexity for London, as I'm sure you're aware, is that London's water supplies are so complex and the degree of disease patterns across the London population is so variable. Over many years, different reports have investigated the cost effectiveness of fluoridating London supplies, and the conclusion has always been that currently it wouldn't be cost effective. So that issue of water fluoridation is a slightly separate one.
My memory, I've been in local government for a very long time, my memory of these great debates in the 70s, I think it probably was, in relation to that, the view was that the pharmaceutical companies would in fact be doing precisely what you said. They put it in toothpaste, and if people wanted fluoridation, I mean, that was the point. It was to do with compulsory medication as opposed to voluntary medication, and people could simply opt for buying the toothpaste or not. Are you saying that that's not working?
No, it is working, and we know the scientific evidence is that fluoride in the toothpaste is a very important element of controlling and reducing dental decay. So most certainly it is working. My point was that there are some new toothpaste brands coming out that are sold in health shop health, what's the word? Boutiques, etc., that are trying to appeal to a different audience where they don't have any fluoride at all, but that is still a very small proportion of the overall market of toothpaste.
Yes. Let me get this right. The average person going and buying a tube of toothpaste is going to buy toothpaste which will have fluoride in it.
Correct.
Okay. So the sort of toothpaste that you're talking about for new things, does it actually say on the thing does not contain fluoride?
It won't say does not contain. It just, if you look at the ingredients, which are often very small, it just won't be listed as an ingredient.
Yes. Isn't that an area where maybe there ought to be some kind of direction that there should be an indication, supposing these kinds of toothpaste get a bigger hold on the market, that consumers should be told, no, this does not contain.
I think that's the point. If those products do take off and become more popular, then I think that would be an issue, because the beneficial effects of those products on your teeth are much lower. So that would be an issue if they did increase their sales.
Okay, thank you. I think I've covered it. Yep.
Thank you, Chair. Umesh?
Thank you, Chair. My question relates to what the Mayor of London can do, something that we usually ask our panelists when we take evidence. And I think it was Dr. Dick Crux who talked about the Mayor of Manchester. So, but talking about the Mayor of London, so his actions on child oral health centre programs like Healthy Early Years, Healthy Schools, Childhood Obesity Task Force, are these programs having a positive impact? And very specifically, are they reaching the right group of children, especially in terms of reducing inequality, which is something that the Mayor's main focus is on, the health and inequality strategy?
Well, I would say they are. I mean, we haven't got the evidence yet to see if that is having an effect in children's oral health. But what we do know is that some of the interventions that we've talked about, some of the awareness-raising interventions, if they're just directed in an undirected fashion, they can increase inequality. So there's a danger, if we're not careful with interventions, that they can worsen the situation rather than improve them. And there's definite evidence of that in certain types of interventions. But coming back to the Mayor's office, the things that I think are most likely to be beneficial on oral health are the initiatives in early years around strengthening early year services and those outreach actions we've been discussing linked to breastfeeding, infant feeding, nutrition in childhood. One issue that is still an issue of concern is that in schools, the policies around healthy eating in schools, it is now, fizzy drinks, confection with sugar, you really can't have those in schools. But in early year settings, the regulations are such that the parents can still bring those foods in, and they're still consumed in early year settings. Now, I think that's one thing that we could strengthen, is the policy guidance on sugar reduction in children's centres and other early year settings. Another example where things are moving forward is your action on local environments, so looking at food outlets, sales of junk food to children, etc. So initiatives around that, again, will have an impact on children's oral health, because children will have less access to sugary foods and drinks, and that will not only benefit their weight, it will also benefit their teeth.
A good example of that is Lewisham Sugar Smart.
So
Lewisham Sugar Smart. Lewisham has a campaign for local traders and schools to sign up to for their action to reduce the amount of sugar. I think they were very early adopters, but not all of the London boroughs have joined that sort of scheme.
Yeah, I mean, I think that support Richard and Pepe in just talking about the same sort of thing the dentists would want, the idea of supervised toothbrushing in early year settings across Greater London. I think the mayors can certainly do that. I think the other thing we've talked about already is this raising awareness, a campaign to raise awareness about the importance of sort of regular attendance at dental practices from an early age, the fact that dental treatment for children is free of charge. So it's those sort of campaign raising awareness that they actually can change people's attitudes, and I think there's a quite easy, straightforward things to do for the mayor.
There's also, in terms of publishing explicit instructions as to how the sugar tax is going to be used. Clearly, it's supporting the obesity agenda, but unfortunately, at the moment, it's not explicit that it's going to support the oral health agenda. So I think we would ask the Mayor's Office that when the 2020 plans are laid forward, that actually oral health initiatives are put in amongst the other initiatives to support how the sugar tax funding is spent.
I'm going to come later on to what things the Mayor can do that he's not doing yet. But Kelly and Claire, any thoughts on your part?
Sorry.
Have you got anything to say?
No, I think mine was more going back to what we'd like from the Mayor, so I think that's where I thought everybody was.
Can I just add one thing I forgot? I think, because I know there's an initiative about in the underground about advertising.
I'm coming to that because I suspect certainly one member I suspect will want to come in on this section. But yeah, there's a specific question. But yeah, is there anything more you want to say? Is there any of you about very specifically, are we reaching the right group of children, and especially in terms of reducing inequalities?
Yeah, and I think the other thing we're quite keen on is specific oral health needs of various immigrant groups. We've sort of referred to that, coordinating relevant, accessible awareness, campaigns about smokeless tobacco, shisha pipes, betel nut and palm. So I think that's quite peculiar to London, something that we'd like some sort of support on.
Yeah. You may already have answered this question, because I know we touched upon this earlier, but very specific in terms of healthy schools. The Mayor says that schools that are healthy schools in London have more children registering at dentists and fewer having dental problems. Is there a direct correlation?
Well, we know with healthy school programs that, yet again, it's about integrating in oral health components. So the diet, the tobacco use, the alcohol, those messages and initiatives are all part of health promoting schools. But actually one issue we haven't mentioned is facial injury and trauma. So in children, there's international evidence that health promoting schools, when they look at the social and physical environments to make them safer places for children to play, exercise, socialise, those type of initiatives also reduce the risks of children damaging their teeth in terms of falls and injury. And that is a fairly significant problem and clinically quite a complex one to deal with, because if a child breaks a tooth, if it's an adult tooth, the repair and treatment, that can be expensive and also take a long time. So those health promoting schools initiatives can also help to deal with that issue of injury and trauma.
But I mean, generally, schools that are in the programme, that does help.
Well, I haven't got evidence from London, but I've got evidence from internationally where it definitely helps those types of initiatives that link oral health into that broader school agenda.
I think it's awareness, isn't it, again? Because by doing any kind of initiative,
it's more than awareness. It's changing the environment.
Exactly. So it should do, would be the answer. Absolutely.
Very specifically, the Mayor's made some interventions around advertising bans and also no new takeaways near schools. Some boroughs already have that in terms of their planning policies. But what advertising bans? I mean, what are your views? Does it help?
Well, I would say the promotion of sugary foods and drinks to children is a national concern, and many public organisations I'm involved with, there's a lot of emphasis about trying to regulate that better. Now, how much control the Mayor's Office has got on that, I'm not entirely sure.
I mean, he's banned high-fat sugar and salt advertising on the TfL estate.
Yeah. But
and
in terms of...
that issue has been raised with him at Mayor's question time. So what are your views? I mean, all of you.
Well, I would definitely support any regulation on advertising of sugary foods and drinks, particularly to children. So initiatives around a watershed, that they shouldn't be advertised below a certain point in the television evening in terms of when young children are watching. But in terms of social media, in terms of boards, etc., I think anything we can do to limit the advertising of these products, because we know the companies spend millions on advertising, and that's because they know it increases their sales. So I think particularly for children, any ways we can try and reduce those advertising and promotions is a positive step forward for public health and oral health.
And I think if in terms of the Mayor's Office organising big sponsored events, then to decline sponsorship from the companies that are promoting fizzy drinks, for instance. They may be sugar-free, but they're not fizzy-free, and fizzy-free drinks are going to cause a lot of dental damage. So, there is something around being slightly more circumspect around sponsorship for events led by the Mayor's Office.
Let us remember Buff Kabir at this stage. I haven't finished yet, but I think this is the right stage for Andrew to come in.
Just on that particular issue, could you supply me with some evidence, or the committee with evidence, of where the ban on advertising has been proven to work to reduce either obesity or improve dental health?
Well, Gerald Hastings in Strathclyde University did a major review of that, so I could certainly do that. Yeah.
Do you think that also that the sugar tax is on fizzy drinks, isn't it, effectively?
Yeah.
What about fruit juices as well? Should they?
Well, the fruit juice, that's free sugars as well, so that is an issue of concern and confusion, because many people might think that fruit juices are healthy, but if you actually look at the sugars in a fruit juice, they're what we call free sugars, so they're the same as they are in Coca-Cola or all these other fizzy drinks. So Public Health England, the evidence is that we should only consume one portion of a fruit juice per day. Anything above that is potentially going to be harmful. Yeah. So fruit juices are...
And also milkshakes.
Milkshakes, another one, yeah.
Flavoured milkshakes.
Absolutely, and milky drinks are not covered, as I understand, by the...
That's right, yeah.
So, when I had a chai latte a few months ago, I was
huge amount of sugar.
It knocked me off my feet with the amount of sugar that was actually in that. But that won't attract the sugar tax. Do you think the sugar tax needs to be a bit better joined up than it currently is?
Well, I think the nutrition people in Public Health England have done a pretty good job of introducing it, because there was concerns that it wouldn't be introduced at all. So I think it's now being introduced. And I think a major step forward is many companies have responded by reformulating their products. So they've reduced the sugar contents of their products, which is ultimately what we wanted. So many of those products now are not over the sugar levy threshold, but they're healthier because the sugar contents come down. But invariably, there's still a lot to do. And I suppose another good example of where the Mayor's Office most certainly has a role is the provision of water in public spaces in terms of fountains. Now, when I was a child, that was a routine thing, and then they disappeared. And I know there's a move to get water, fresh water fountains available in public spaces so people can access fluids when they need them in terms of hydration, and also not using lots of plastic bottles, etc., etc.
That's certainly part of the Lewisham programme. It's not just about sugar, it's also about free water top-ups, businesses advertising that they are a free top-up place for water, and also supporting the plastic, the recycling of, and that's part of the Lewisham programme.
Just to reiterate from what you said earlier, what really works is working in with the communities locally, changing attitudes and all the rest of it.
I think it has to be at the local level.
Has to be at the local level.
Obviously Richard and his colleagues will give us all the evidence that we need, but I think we need to make sure that things are implemented at the local level, which is some of the things that Len's been talking about, and Kelly and Claire. I mean, it is about being joined up at the local level between the local authorities, Public Health England, the education of the dental workforce through HE England, and what we can do with the local dental committees. It is about implementing a strand of things at the local level.
The Mayor's, of course, got an obesity task force. It hasn't done much at the moment. It's cost us quite a bit, doesn't done much. What would you recommend that it do in order to meet the objectives that we all have of reducing the instances of tooth decay?
Well, I would say that the obesity strategy is an ambitious document. In terms of implementation, as I say, I don't quite know the details in terms of on the ground implementation.
I wish I did.
Okay, well, but I think at least the vision is there, and I think we know from public health evidence that to address something like obesity, it needs action on the environment, the local environment, the provision and food choices available, as well as increasing access to physical activity. And all of those things will benefit oral health ultimately as well.
So what you're basically saying is local efforts work much better than any gestures or words.
Well, I think what works best, we know from public health, is things that actually change the choices people have available to them. So if we can change the environment to enable people to make healthier choices, those are the things that last and have sustainable benefits.
Only 5% of the people who see adverts on the TfL estate are children, and that's cost the mayor £13 million. Can you think of a better way of spending £13 million?
Give it to the dentists.
Yeah.
I think it's having it's having a coordinated approach between the various agencies so that we use the money wisely.
But I do look forward to the evidence about advertising bans working, because
I've got it written down, I shall.
Not seen it anywhere.
There's a challenge there for you.
In all the successful programmes that
You do educate at this committee.
Yeah.
Okay.
Thank
Carol.
you. Thank you.
Yeah,
Thank you.
a couple more questions. I mean, the policies in the draft London plan banning new takeaways within 400 metres of a school. I mean, what are your views? Because some people like the view that's simply just gesture politics. At the end of the day, there's more education and awareness raising, as you said. If, whether it's a takeaway is 400 metres or a mile away, if someone wants to go and have a fried chicken and chips, as usually see kids all over London at 4 o'clock, they're going to go and
But I think, well,
chicken and chips.
well, whatever fast food shop.
I personally would say the number of times we've heard about awareness this afternoon is probably a bit too many times, because I think, of course, awareness is an important part of making a decision. But again, the evidence from interventions is raising awareness. We can do it, but it's always short term. It always fades down over time. So, over many, many years, we've had all these initiatives about raising awareness. Now, the fact is, the evidence on these interventions, they fade very quickly. So I'm much more of a support in terms of making the changes to people's environment. So the initiative about looking outside of schools and the shops where they're located, I think is a significant step forward, because that does make a difference. Now, ultimately, people might walk further down the road to get their chips, but that's a barrier, that's a nudge in the right direction. So I would strongly support the initiatives that are about changing the local environment, because we know from public health evidence that's the things that ultimately do make a difference.
And that'll get exercise, walking to the longer to the grab shop, yeah.
Are you all agreed, or is there a dissenting view?
No, agree with that.
Well, in this case, I come to my final question.
I will ask, are chicken and chips bad for your teeth?
No, we're not getting effect.
Bad for you in terms of obesity.
Depends how much vinegar you put
If
on
you're the fizzy drinker,
Depends
Well,
if you
exactly.
put lots of ketchup.
ketchup and vinegar. Ketchup and vinegar.
Ketchup? Okay. Okay, so we'll ban that. Aren't all these interventions that we're talking about actually taking away food from working people, that working people have chosen to eat?
I think that raises a very important...
Because the middle classes never seem to get hit by these bans. It always seems to be the working classes and the diet of the working class that comes under attack and restricted. I mean, is there anything you've given up? Or any of us? What should we, as middle class people, have taken away from us?
But the evidence we know from nutrition is middle class people eat a healthier diet. The challenge we have is that people in poorer communities are the ones eating much higher levels of sugar, and Public Health England surveys show that very strongly. Now, they're the ones that can benefit the most if these things work. So I would sort of turn it around the other way. If we could improve the environments of those people and they don't have to suffer general anaesthetics and obesity and all the other problems, we're benefiting and improving their lives. So
But is improving their environment removing choices from them?
it's giving them choice.
Really?
For children, we may have to regulate their choices, but...
This debate is moving to
No, I'm just asking
the
questions.
political gender, right?
You've got a pretty good idea where I'm coming from.
I mean, the only thing I would say that people don't make bad choices because they choose to make bad choices, but they have found circumstances they have to make their choices. But
people
before
can't
we
be trusted.
delve too much into party politics.
I think-
Can we just come back to this?
I think we can go on about people's takeaway habits, but my final question, what specific action, and if we give, say, one example, can the mayor commit to that he hasn't yet done? One specific thing, just to all of you.
I would ask for increased funding of health promotion activities at local authority level, because that budget has been so restricted, and a lot of these community interventions like fluoride varnish, toothbrushing, those budgets are absolutely tiny compared to the budgets for dental services.
And they're ring-fenced, absolutely ring-fenced to oral health promotion. So they're not, so when you're having those discussions, they're not transferred elsewhere or gone into a black hole somewhere else. So it's absolutely crucial that they're ring-fenced specifically, because that would really help joint working, I think, with all of these initiatives.
No.
And also linking it into the Healthy Early Years Award, because by participating in supervised toothbrushing, settings are able to achieve the awards. So.
And I'd reiterate the whole, and I know Richard has said raising awareness may not be the answer, but I still think we should be raising awareness for, in terms of the importance of regular dental attendance and recognising that treatment for children is free on the NHS under 18.
Okay, I just want to say that it's not the mayor that sets the public health spending budgets. It's sent by central government, right? Okay, and that's where the cuts have taken place from there. So it's not something which the mayor can change anyway. But I know the mayor is committed to public health, right? And repeatedly, at question time, I raise this matter with him, and But I think certainly the cut rights have been taken public health, and we need to protect them, right? We need to not protect them, but reverse them, right? And local authorities, of course, we need to make sure that they're using money for public health, not for filling the potholes in the road, right? Okay, so I think that's a key issue. But anyway, I want to thank you all, right, very much for your contributions this afternoon and for coming here. If you think there's something you remembered, or you're saying we should send something, or I know you promised to send us a paper, Professor, but maybe you'll send it to the Health Committee Secretariat, okay, so it'll be shared with all the members of the committee. That'd be very helpful. But if any of you think there's something you've missed, right, or wish you made this point, or there's something evidence you come across, please feel free to let us know. And I just want to say thank you once very much for taking your time up and adding this contribution, which is very important, and we obviously sometimes overlook the importance of oral health. I mean, earlier on this afternoon, I was meeting the members from Southwark Council who had a fizzy-free February. And this sort of campaign, and maybe next year we can get the mayor to support that in a more public way. But thank you very much for coming. And so I just got to have some formalities of committee work to go through before we end this meeting. So can I please ask the committee to thank our guests for the contributions, and can I note the report and discussion with the invited guests, and also the delegated authority to me as chair in consultation with the deputy chair to agree any output from the discussions. Yeah. Can we note the response from the head of health to the GLA's, to the GLA, to the committee's report on healthy first steps? Yeah. Also, can the committee please note the topics covered in the 2018-19 Assembly year and the schedule of its provisional meetings of the committee for 2019-20, subject to the annual meeting of the London Assembly on the 2nd of May. Can we please delegate authority to the chair in consultation with the deputy chair to agree any further outputs relating to the committee's investigation of the 2018-19 Assembly year and arrangements for any side visits, informal meetings or game activities before the committee's next formal meeting. Note the transcript from the Health Committee's open mic discussion on the black and minority organ donation. And can we please note the committee's next meeting will be on the 13th of June, subject to the confirmation of the London Assembly annual meeting on the 2nd of May. Thank you very much.